and welcome to Deuk Spine Institute live stream. Our patient comes from California. She's had a fusion done in California at UCLA by the head of spine surgery, still having a lot of problems from that fusion. She's here at Deuk Spine because she wanted the best care for herself. She's watched all of our videos. She sees what we do. She loves it and doesn't want invasive surgery. We're treating her facet joints right now. She has facet joint arthritis and pain. Let's show the audience what I'm talking about when I say facet joint arthritis and pain.
For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
All right, you just saw how facet joints can be painful by being injured and getting inflammation in the joint. The best treatment for facet joint pain is the Deuk plasma rhizotomy. This is a patented treatment. I literally just felt the pain nerve get cut. Show them where the nerve runs. Let's give them an anatomy lesson. Show them the pedicle, show them the vertebral body. Vertebral body of L3, show them the left pedicle of L3. The transverse process comes out like a finger to the side. Where does the medial branch of the dorsal ramus run? Right there. And that is where my probe is. This is our Deuk plasma probe, and it is a probe that specializes in cutting and destroying pain nerves. Now, other doctors use a procedure called RFA. The problem with RFA is it doesn't work in more than 50%, and the ones that it does work, it never lasts. The pain always comes back. So, I pioneered a new technology called the Deuk plasma rhizotomy, which is a permanent, basically a permanent, effective RFA. How are you doing, Hector? Did you hear what Berndes said? He loves the intraoperative Robaxin. Sean? Oh, I like flexible. Flexible's good, especially if you're playing Twister. All right, any questions, Sean?
Yes, we have one from CBSG Tarzan. He had an L4 to S1 posterior interbody fusion in 2025 and just found out that his screws are loose and the bone is not fused yet. Any thoughts on why this happened so quickly?
Yeah, great question. First of all, why are the screws loose? Why is it not fused? There's a lot of reasons for failed fusions. I just want to point out you did not have your surgery at Deuk Spine Institute. So in case people are wondering, I'm sure you had it somewhere else. But the point is, why do people not fuse? Many reasons. Number one, bad bone metabolism, AKA your bone's metabolism is not good. You don't form bone. You have poor osteoblastic activity. You have too much osteoclastic activity where the cells that absorb, the cells that absorb bone are overactive, osteoclasts. The cells that make bone are underactive, osteoblasts. So hormones affect that, smoking affects that, osteopenia affects it, osteoporosis affects it. There's a lot of reasons why people don't make good bone. So that's the number one problem. You did not make good bone. Now, it could also be that your hardware was not put in properly, and you can see that it's loose. So if the hardware is not put in properly, then it never holds your spine still. If your spine is not being held still, then it's going to move around. If your spine is moving around, well then guess what? You're never going to fuse. It's kind of why we put people in a cast when they have a fracture, right? You put them in a cast so the bones don't move. When they don't move with respect to each other, they fuse. So if your spine is wobbling around and the bones are moving, well, they're not going to fuse. Sounds like you got loose screws because, I don't know, surgical technique has a lot to do with it. Have I ever had a loose screw? Sure. I get about 1 loose screw in every 500 screws that I put in. But some surgeons have a much higher rate of loose screws because they put screws in that are too short. They put screws in that are too skinny. They put the wrong kind of screws in because they're being paid off by the company to put in that company's screws. Even though the screws are terrible, they don't have a good design. Yeah, so if you have, for example, the pitch on your threads of your screws is too wide, then your screws aren't going to have as much purchase in the bone, right? So you want to make sure your surgeon is using the best hardware when they do your surgery, not the company that's paying them off to be a consultant. Watch the movie Spine Scam, and it should make sense to you. There's other reasons. Too small of a cage. They didn't prepare the disc space properly. There's a whole list of reasons, more than I can name right here. All right, have we shown the audience how the Deuk plasma rhizotomy gets rid of facet joint pain?
Not yet.
Let's do that.
Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. We are done with the DPR, Deuk plasma rhizotomy, pioneered, invented here at Deuk Spine in Florida. It is the only permanent rhizotomy in the world, and we do it with a 4mm incision. Hope you enjoyed it. We're out of time on this case. We'll be back for our bilateral SI joint Deuk plasma rhizotomy. Go ahead and end the broadcast.